so we can welcome the class of 2015. Get your pictures, okay? Good afternoon, I'm Mike Merson and I direct the Global Health Institute. My main task here is really just to welcome you, friends and parents and families and friends of our undergraduates. Many of you I know have traveled great distances to join for this wonderful occasion. I know you probably have at least 4 events to go to. At least 4, maybe some of you have more. There are few events, though, in one's lifetime as important and memorable as a graduation ceremony, a graduation weekend, and we're delighted to have you with us. As long as the weather holds, I'm sure you will have a very wonderful weekend. Now, this ceremony is to recognize our graduates who were pretty brave, actually, and chose a new co-major in global health. And we have a few others that actually went into global health through being part of our certificate program or Program 2 student. We're delighted that we have almost all of them here today. Let me first, though, say that most importantly, I want to recognize our faculty that are here. You know that a university is a special place. It harnesses the passion and creativity of young minds and matches them with the experience, skills, and knowledge of faculty. And we're very fortunate in having in our educational program a wonderful group of faculty that serve as instructors and mentors from all over the campus for our students. We just would not have the educational program that we have if it wasn't for them. So let me ask them to stand, and at least the students should give them a round of applause. That's the first time you've done that. It's good, thank you. So we are, for the parents, we're not a department, we're not a school, we're a university institute. We were one of the first in the country to make a commitment to education and research in global health, largely because of the advocacy of Duke students. And we like to believe that today we're one of the top global health programs in the country, perhaps in the world, in what is a large and growing field. The major that we have was probably one of the first or the first of its kind in the United States, but just to give you some idea of how popular it is, in less than 3 years, and Dr. Bennett will talk about this more, it has already grown to 156 students who are co-majoring and 153 students who are minoring in global health. It's only been here for 3 years, and we have, 309 undergraduates who have signed up to have global health as part of their education here at Duke. Now, as I mentioned, our major has to be taken as a co-major, so you have to have a second major. And what's really fascinating is that our undergraduates, if you look at the 300 plus students, they are in 23 different co-majors. And they range the humanities, the natural sciences, and the social sciences. So it's a very unusual program, and we're delighted that we have had the opportunity to lead it. Now, why a student interest in global health? Well, how about just think of some headlines in the past year, even in the past week. I'll just pick a few things. Ebola, how many times have you heard about Ebola? Climate change, there really is such a thing as climate change. The earthquake in Nepal, all over the news. Access to health care, high quality health care, in the United States, but everywhere in the world. All of these are areas in which our faculty are involved and show why the interest of global health is strong. We believe in our institute, that's why we're a university institute, that it's only through an interdisciplinary approach that we can advocate and use as the foundation of our educational and research programs and what is needed to address the global health issues like the ones I've mentioned. Let me, before turning this over to Dr. Bennett, just say to the graduates that I know I don't need to tell you that you are at the forefront of what we feel is an amazing and exciting field poised to make an impact. You have great mentors in your faculty. It is because of the chance of making an impact that I know that many of you chose to study global health. Many of us are inspired by your passion to make the world a better place. And let me say to the parents and families that are here that you really should be proud of your daughters and sons for displaying and acting on their passion during their time at Duke. We don't have to tell them, but I have to think that you all played some part in their passion and in their success. Graduates, I'm confident that you've learned here will set you in a wonderful place for whatever's next to come. I'm proud, we're all proud of what you've accomplished. We know that when it comes to the future of health in the world, it's brighter because you have started at Duke. I know you will achieve great things, and I'm glad that you chose the Duke Global Health Institute to be part of your journey. That's all I want to say. I really now want to introduce Gary Bennett, who is the Director of Undergraduate Studies in our institute, who's made this happen along with the faculty. I want to publicly thank Gary for his outstanding leadership and enthusiasm in supporting our students and positioning our institute in Duke as a leader in global health education. Gary?
Well, good afternoon, everyone. It is my distinct honor and pleasure to speak on behalf of my faculty colleagues and congratulate the class of 2015. You all are an amazing class, and every year you say that this is my favorite class, but really, this is my favorite class. Now, parents and loved ones, look, we all live in a world that is increasingly connected. We're digitally collected. I'm looking at so many of you with all manner of digital devices pointed in my direction. I'm not having an anxiety attack, really. But I know that during these last 4 years, you all have stayed in close contact with these students. I know that because on occasion I have in class seen them texting, not these students of course, but some other students I have seen texting, and sometimes I'll say to them, who are you texting? And I'll find out it's their parents. And that mortifies me just a little bit, but I know nevertheless that all of you have been staying in close touch with your students. And I suspect that you know a little bit about what they've been doing. You may have learned more than you need to know, but I thought that what I would do is spend a second talking about what they've been doing. In the meantime, I imagine that some of you are probably wondering why your students are running around the world trying to catch mosquitoes with nets, or why some of them are running towards emerging infections as opposed to away from them. And I know firsthand that some of you have spent a lot of time on Google trying to figure out exactly where your children are in the world. They've done some amazing things, and I just want to spend a few minutes talking about what they've been up to. So as Dr. Merson said, the first thing is that these students have blazed really unique educational paths. If you're anything like me, you went to college and you picked out one major, just one major. That was all mom or dad was paying for. And you took that major, and that major had been around for decades, if not hundreds and hundreds of years. But not these students. They are consuming knowledge at the same time that it's being created. And in many cases, they are actually creating knowledge themselves. Today, we're going to honor 3 very special groups of students. We're going to honor those who've completed the global health major, those who have completed program 2 with an emphasis on global health, and one who finished our certificate program. Our students come from myriad disciplinary backgrounds. We have 14 majors graduating today, as Dr. Merson mentioned, including students who've taken co-majors in psychology, evolutionary anthropology, and history. And I know that for a long time, as long as you've been affiliated with Duke, and probably before, you've been hearing about the interdisciplinary nature of our university. And I think that these students really represent the best of what Duke has to offer from an education perspective, because they have embodied the interdisciplinary ethos of our university. Our global health major graduates have completed a unique program. It's unique at Duke, it's unique in the United States, and I will say it's unique in the world. They're the only ones that have done anything quite like this, because our major is the first and only liberal arts major that's offered at an institution like ours. It's offered just as a co-major, and so the students have to complete their global health requirements and also the requirements from another major at Duke. And this is a very rare thing at Duke University, and as I mentioned, nationally, and so we're very proud of those who've accomplished the major. Now, 3 students went above and beyond these requirements, and they completed an honors thesis and received graduation with distinction. Now, one of those students, Scott Weber, he completed a dual thesis in global health and biology. 2 students, Divya Ginani and Sammy Chung, they incorporated a global health honors thesis into their already complex program 2 degree. Now, Scott, Divya, and Sammy, please stand up so we can clap for you. I call them rock stars all the time. Now, many college students at universities like ours, they take pretty cushy internships during the summer, but not the class of 2015. They've actually gone out in the world and gotten their hands dirty, and oftentimes literally dirty. They step outside the classroom, they engage in the field, they become part of the research and service and policy efforts that shape global health. And along the way, they confront poverty, they confront the challenges of cross-cultural communication. They ask important questions like, where's the bathroom? And is that really a bathroom? I want to give you a few examples of our students' fieldwork projects. Through our student research training program, several traveled to the highlands of Guatemala, studying indigenous medicine and health promotion, while others researched community health and sustainable development in Tanzania. One student worked to better understand issues experienced by farm workers in Boone, North Carolina, looking at health access and the hurdles that lead to poor health outcomes in workers with language barriers and limited resources. And still another worked with the National Cancer Institute in Washington, D.C. to create strategies to address cancer as a global disease, focusing on identifying organizational opportunities and modifying models for cancer control on a global scale. Other students integrated their experiences with Duke Engage in Uhuru Bay, Kenya, working to evaluate a clean water program implemented by WISER, a development organization with a focus on the social empowerment of underprivileged girls. And finally, let me say that this class of 2015 is going to go on to do some amazing things. I happened to bump into one of the students who graduated last year in the airport yesterday, and she was running hurriedly through the airport with her bag, and I stopped her and I said, hi. And she kept running, and I grabbed her again, and she told me that she's working to do research on behalf of an NGO, and she was headed overseas. I got an email just this morning from a student who graduated 2 years ago, with whom I'm going to have lunch sometime soon. And she's now in medical school and just was describing all of the amazing things that she's experienced. I talked to another student just last week who graduated a year ago, and she started a nonprofit in Baltimore that is now beginning to serve some of the kids, poor kids in the city who've been disenfranchised recently. So I know these students who are in the class of 2015 are going to be no different. And one of the most exciting things about being a professor here at Duke is spending time with these students and imagining what they're going to go on to do in the world. And with our students, we don't actually have to do all that imagining. It's clear that these students are going to take leadership roles. There's really no question about that. They're going to do that in global health and beyond. Many have chosen to head back to school for graduate and professional studies, and some are going to continue global health research and service. Now, some of our graduates, just to give you a couple of examples, our graduates are going to pursue medical degrees at Harvard, and some are going to be applying to medical school next year. Some are going to pursue graduate degrees at the London School of Hygiene and Tropical Medicine. We have one who's going to be working for the EPIC Foundation, and another who's going to be working for Bain Capital. And that's just a few. Now, this is a very special group of students, and we noticed that from the minute that they stepped on our campus. Every day, their curiosity and their intellect and their drive keeps us, their teachers, their advisors, their mentors, sometimes their friends, on our toes. And their passion is one of the primary reasons that global health is growing here at Duke. And this class of 2015 is the largest that we've ever graduated. And in those 4 short years, they've worked hard, they've learned much, and they've shared their talents and their spirit with communities all over the globe. And fortunately, they're just getting started. So congratulations, class of 2015.